Welcome back to Time Warner Cable's Local Edition. My name is Brad Pomerance. I'm glad you're still with us. Our guest is Ed Hernandez. He's a member of the California State Senate, also a doctor. And I thank you for joining us. I want to talk to you about healthcare reform. As you know, the federal government passed healthcare reform in 2009. And California has been one of few states that has actually embraced the Obama healthcare reform plan. The Republican governor, Arnold Schwarzenegger, had some implementing legislation pass. What's the status right now of healthcare reform in California?
Well, California is the first state to have the exchange. So as you mentioned, we are taking the lead in it. And as being chair of the Senate Health Committee, I believe I'm in the right place and the right time in history to make sure that we implement federal health care reform right on time.
Could you explain what it means that we are implementing the exchange, the health benefit exchange? What does that mean for us?
Right. Well, the federal government is requiring every state to create a health insurance exchange that the insurance companies can be able to sell through that. And there's 5 products that they can sell to the public. And in that exchange, it allows market to be able to keep prices down and get the best deals.
And is that for people who don't get insurance either through their employer or through a government benefit?
That is correct. So in 2014, we're going to have 6 million new Californians. Half of those will be on Medi-Cal, which is the state aid, and the other half are going to be eligible for the exchange, and then there's different benefit levels that they can apply for and get different kind of subsidies through the federal government.
It's interesting, when you look at healthcare reform today, if you ask the public generally, what do you think of healthcare reform, the Obama plan? Probably split 50-50, some would say yes, some would say no. But individual elements of healthcare reform are wildly popular. For example, pre-existing condition. For example, allowing your adult children to stay on your plan until the age of 26. As more elements of healthcare reform on the federal side become activated, do you think the public will warm to it more? What's your sense?
You know, I definitely think so. And what's going to happen in 2014, it's going to be a historical moment because the last time we had any kind of major federal healthcare reform change was in the mid-60s during the Medicare Act.
Of course.
And a lot of the uncertainty is for the individuals who already have insurance because they're afraid of what's the changes to come.
Are there changes to come if we have employer-based health coverage?
Well, the changes are going to come mainly for those individuals who don't have insurance, who don't have access to health care, and how difficult it is. Some of the comments you made with pre-existing conditions, an insurance company can no longer inhibit.
That's enforced.
It's it, yeah. What you also mentioned about the children. So there is going to be huge advantages.
That helps your children, their college age.
It helps my kids, yeah.
Right. At the same time, while healthcare reform has not been fully implemented, and one of the goals was to contain costs, so we don't know if it will truly contain costs, but we do know that premiums continue to rise. We do know that drugs costs continue to rise, costs for doctors continue to rise. What can we do, what can California do to try to maintain or limit the rise in healthcare costs?
Well, that's exactly what the purpose of the exchange is for. By having a mandate that everyone has health insurance, you're going to have more people in the pool, you're going to have a healthier pool, you're going to spread the risk. They're going to be able to buy in much larger quantities, get a better deal, and then pass it on to the consumer.
Is there anything that you're doing specifically, any bills that you are floating to deal with healthcare here in California?
Yes. One of my signature pieces of legislation we're working on is called the Basic Health Plan. The federal government is allowing every state to create that, and what we can do is we will draw down 95% of federal dollars for individuals between 133 to 200% of poverty level. This is the working poor in the state of California who has the least access to health care.
How's the bill doing?
And it's in a 2-year cycle. We're moving. We're actively talking to the administration. I'm hoping to put it on his desk and get a signature. But what's going to happen, you're going to get a better product, more services at a lower out of cost, and it's been modeled. It'll be $20 to $30 a month.
Dr. Ed Hernandez, he is a state senator for California. I'm Brad Pomerance. Thank you for watching Time Warner Cable's Local Edition. Back to HLN.